here today to talk about hypertension. This video is mainly, the purpose of this video is just for education, to educate people about the signs and symptoms of hypertension. Most of the time people don't have symptoms, and that's why it's called a silent killer, because most people have it and they don't know they have it because they are not able to recognize the symptoms, or they're not having symptoms. So blood pressure hypertension sometimes is defined as a condition which the force of the blood against the artery wall is too high. Usually hypertension is defined as blood pressure above 140/90, and considered severe if the blood pressure is above 180/120. Sometimes people don't know when their blood pressure is high because they don't check it. There are so many ways you can check your blood pressure. You get the blood, most people have to have blood pressure machine in their house as part of their house property. It's a good investment to know your family members' blood pressure, because when you know the blood pressure, you'll be able to start early to prevent, hypertension, or to treat hypertension. So sometimes, like I said earlier, some people have symptoms. So some of the symptoms is severe headaches, nosebleed, fatigue, or you're confused, vision problem, blurry vision. You begin to have vision problems and begin to see double, and chest pain, irregular habits, and sometimes blood in urine, nervousness, dizziness, sweating, facial flushing. And when you start having these symptoms, it's time to, go to the doctor and find out what is happening. And some people's blood pressure is diagnosed by mistake. Maybe they go to doctor for other reasons, and they check their blood pressure, boom, it's high. And sometimes there's what is called white coat syndrome. That's when you go to the doctor's office and your blood pressure is high. So it is very important you check your blood pressure. For those of you that are outside United States that don't have access to blood pressure machine to measure your blood pressure, I would encourage the churches, the organizations, and some people that are rich in the community to buy blood pressure machine and donate to their community, and get someone to check their blood pressure for them, and so that they will know what is going on. Most people have died, in their sleep. Most people just fall down and die, especially in those countries in Africa, because they're not monitoring or treating their blood pressure. So I would strongly advise those countries that don't have access to medical care, the communities can volunteer and help. In those cities that have rich people, or in the villages that produce more rich people that we're doing, in order to contribute, to give back to your community, you can order these blood pressure machines and donate to your villages. And, the churches can organize health fairs, and check their blood pressure and get them to the doctors. And some of the doctors in the villages, in the cities, can volunteer and help these people. That is how villages and people are developed. People volunteering their talents, to help other people. So anyway, let's proceed. Uncontrolled hypertension can cause a lot of health issues. And that is why early prevention is important. So uncontrolled blood pressure can cause blindness. It can cause bleeding inside your eyes. It can cause kidney failure. It can cause heart failure, heart diseases like left ventricular hypertrophy. It can cause brain stroke and death. So, moving on. How do you prevent hypertension? And how do you, for those of you that eventually find out that you have hypertension, how do you treat it? There are so many medications out there that could be used to treat hypertension. Sometimes the medication is based on somebody's like race, like there are medications that, according to research, that is very good for Caucasians. There are good medications that have been researched that are good for African Americans. So when you go to your doctor will be able to educate you, let you know what medication is good for you. And sometimes if you're not able to tolerate them, the medications that are given to you, you will be invited for another visit follow-up to try out other medication. Blood pressure could be treated with more than 2 medications. The most important thing is to get it under control to prevent other health organ damages, like I mentioned earlier. So exercising at least 3 times a week, weight loss, exercise is very, I can't emphasize on exercise more than enough. It is important to exercise, to stay active. I know that this is not the first time you have had it. Exercise, there are lots of health benefits in exercise. It makes you feel good, it makes you look young, it makes you lose weight, and watching what you eat is also important. Cutting down on fatty food, carbohydrate. Sodium is the big one. Cutting down on sodium is very important. And I think the allowed amount of sodium a day is like 2,400 milligram, if I'm not mistaken. So there are different types of hypertension. Some hypertension is primary hypertension, which is called essential hypertension. Sometimes you don't have symptoms with those ones. There is the one that is called secondary hypertension. That is the one that is caused by other issues, by renal, kidney problems, by thyroid problem, endocrine issues, that is caused by sleep apnea. So, and when you go to your doctor will be able to find what kind of hypertension that you have and be able to provide the right treatment. So by ordering labs, your electrolytes, your kidney panels to check the condition of your kidney, because sometimes this hypertension can damage your kidney, or it is caused by a problem going on in your kidney. So your doctor will order your heart profile panels, EKG to get a baseline EKG, chest X-ray to make sure that you don't have enlarged hearts, enlarged ventricles, and your UA too, to make sure that you're not shooting out protein or blood in your urine. So anyway, that is it for now. We will continue on hypertension on the next video. So the main point to take home today is it is important for people to check their blood pressure. If you find the problem early, you'll be able to prevent the damages it could cause and able to get it under control and able to live long. Secondly, you can prevent hypertension by watching how much salt you put inside your body every day, by exercising, making exercising as part of your living every day, as part of your daily lifestyle, by cutting down on stress. I mean, you don't have to solve all these life problems. If you put it in your head, it's gonna weigh you down and it's gonna bring you down. So cutting down on stress is very important in managing or preventing hypertension. So other things too, like if you're a smoker, it's time to stop smoking. You know, you need to give up something. So you need to start and cutting down on alcohol intake. So that's it for now. If you like my video, give me a thumb up, push the button thumb up, and subscribe too, so that you can keep in touch with my other videos. Have a wonderful day. Bye for now. And again, my name is Sharon, the MP. Bye.